Welcome to Dr. Tom Talks. Today, with the help of the BioDigital human, I'm going to be talking about the most prevalent variant of coronavirus right now in the United States, BA.5. So what's the difference between this variant and other previous variants? How can you protect yourself against it? And should you be concerned? Well, the biggest difference between this variant, BA.5, and previous variants of the coronavirus is the mutations that have caused the spike protein here to change on the virus. This is the virus itself. So this is an Omicron variant of the coronavirus, but it's different to the original Omicron BA.2. So the spike protein has been mutated so that it actually evades the immune system more effectively. Think of the spike protein as the key which opens the door to enter our cells and infect them. And there's been another mutation that has meant that this is a virus which replicates more easily than previous variants. And so you're more likely to have the virus for longer and to shed the virus for longer. So let's just take a look at what happens, what should happen if you have immunity to the virus. Let's say you've had previous infection or you've been vaccinated. So here are these green things called antibodies, and they should connect to the spike protein on the coronavirus here, which you see. And that means that these spike proteins can't connect to ACE2 receptors and then gain entry into our cells. This is an epithelial cell or an airway cell. So that's what should happen. But what we're seeing with BA.5 is that somehow, because of this mutation, these spike proteins evade the immune system. They're able to connect to ACE2 receptor and then enter our cells and then replicate and then go and infect other cells. But it's not all bad news. Yes, this particular variant is up to 4 times more resistant than BA.2 against mRNA vaccines. But mRNA vaccines and previous infection don't just affect antibodies. They give you other types of immunity, like B-cell immunity, T-cell immunity, which does help your immune system fight the infection. And that's probably the reason why, or could be one of the reasons why we're not seeing this cause any more severe infection. So it's not causing more severe infection than previous variants. So we're not seeing a drastic spike in hospitalizations or drastic spike in death rates, which is definitely good news. So how do you protect yourself against the COVID, against this particular variant? Well, very similar to previous variants. Make sure your vaccines are up to date, including boosters. As I mentioned, this does still protect you better having been vaccinated than having not been vaccinated. And if you've had previous infection in the last 14 months, that means that you have up to 97% protection against all current Omicron variants of coronavirus, which is also good news. And the other thing is, obviously, keep up your hand hygiene, keep washing your hands, bring that hand sanitizer. And then some healthcare professionals are also still recommending to wear masks around people you don't know or in crowded indoor areas. And that is, at the moment, a personal choice. For any more information, please go to biodigital.com.